Good afternoon, everyone. I'm Governor John Carney. Thank you for joining us for another update on Delaware's response to COVID-19. It's good to be with you again. We stopped our weekly press conferences a couple weeks back on July the 13th, when we had a town hall meeting. The state of emergency was suspended that day on July the 13th. And we were in a pretty good place. Today, we're going to talk about the significant change in circumstances with respect to the spread of COVID-19 across Delaware, and in particular, the Delta variant of COVID-19, which is proving to be problematic. We are in a better place in the sense that we met President Biden's goal of having 70% of adult Delawareans vaccinated by the 4th of July, and we celebrated that, and now we're into a little bit of an uptick in surge across our state, which we'll talk about today. I'm joined again by Dr. Carol Rattay. Thanks for Dr. Rattay for joining us, and again for all the things that your team at Public Health does. AJ Shaw, the director of the Delaware Emergency Management Agency, is not with us today, but his team continues to test and help with vaccinations, although most vaccinations are being done in the pharmacies across our state. And of course, we have Pam, who's our sign language expert for the deaf and hard of hearing. I think the best way to illustrate the change that we've seen over the last month, 2 weeks in particular, if you think about the improving conditions, we hit a bottom in terms of the number of new cases on a daily basis, 7-day moving average. About June 20th, late June, there we were about under 20 cases per day. Percent positive, the tests that we were doing were 1% or less, and our hospitalization had bottomed out just under 20. If we'll go to the data dashboard and take a look at where we are as of today and yesterday, I guess, in most cases. So we've gone from under 20 to 135 new cases on a 7-day moving average. You'll see from Dr. Rattay's presentation that the vast majority of those are the Delta variant. We've gone from 1% or less in positive tests to now 4.3%. You'll remember that our target always has been to be under 5%, so we're still below 5%. Hospitalizations have increased, not as much as new cases and positive tests, of course, but we've gone from 20, a little bit below 20 now to 53 hospitalizations, an indication of the seriousness of the disease. The lives lost number is really not, we can't make a comparison because a number of those deaths were added to the total after further review, and they predate the current time frame. So things have significantly changed in terms of the number of positive cases and the number of positive tests. Now, it's important to point out as well that we're not doing as much testing, so some of that is a result of a smaller denominator there. Hospitalizations, which is clearly something that we can track, we know is real because the hospitals count them. And as you can see, it's more than doubled over the last couple weeks. At the same time, if you look at the number and percentage of people that are vaccinated, we met our goal of 70% of adult Delawareans, those 18 and above, to be vaccinated by July 4th, President Biden's goal for all the states. We were one of the states that met that goal a couple of days before July 4th, so we were able to celebrate, and we did across our state. I did our early morning gathering in Laurel, a parade in Smyrna Clayton, and then a parade later that day in Dover, and folks were really excited to be out and enjoying the festivities of July 4th. We've continued to increase vaccinations. We've administered over 1 million, as you can see the top line there, and 15,000, almost 16,000 are fully vaccinated. But it's not even across age groups, and that's a point of significant importance and concern. Overwhelmingly, our seniors, those 65 and older, are overwhelmingly vaccinated with at least one dose and overwhelmingly fully vaccinated, almost 90%. That number's not up there, 95%, rounding it up, of 65 and over with at least one dose. 73% Delawareans 18 and above with at least one dose. And 70% of Delawareans, almost 71%, 12 years and up with at least one dose. But we're going to see in a minute, as we break those down by age groups, we're going to see that it's not evenly distributed among the population, and we have some problematic areas. So fundamentally, what we're seeing is that this Delta variant is spreading among that population of Delawareans who are unvaccinated. And so those folks that are unvaccinated are prolonging the pandemic. They're bringing us to a place where we have to reconsider mitigation efforts, and particularly as we look to the fall to get all of our children back in school for in-person instruction, recognizing that children under 12 will not be eligible for vaccination. We know we're doing pretty good with 15 to 17-year-olds. You'll see that in a minute, and we need to get more of our young adults vaccinated. So looking at the spread of COVID-19 and the Delta variant in particular, 99% of the cases are with folks that are not fully vaccinated. 99% of the hospitalizations similarly are among the unvaccinated, and a very, very high percent of those who are succumbing to COVID-19 are unvaccinated. So here it's really kind of a simple matter and a direct matter for all of us. We want to get all of our children back in school full time for in-person instruction. That's been our objective for months now. We know that the districts themselves are working on it. We want to get businesses and we want them to remain open with no restrictions. And we want to move on and rebuild from this crisis and accelerate out economically. And we're seeing that. Lots of job opportunities available, businesses fully on. I've seen and been in restaurants and social gatherings where people are out and enjoying those venues. We can do all this and we can prevent going backwards here if we get more people vaccinated. And so that's the number one objective, and that is to get Delawareans vaccinated. Let's take a look at the vaccination rates by age group. You can see, as I said, we're making pretty good progress with the teenagers that are eligible, so age 12 to 17. 44% of those statewide are vaccinated, 51% in Newcastle County. It does lag, 36% and 32% in Sussex County. So we need to lift up those vaccination rates in the lower part of our state, continue to vaccinate upstate, and move that number up. That number is just a percentage, almost 2 percentage points lower than the young adults. And this is really where the challenge is. So young adults 18 to 34 statewide, only 46%. So more than half of young adults are not vaccinated. So if you're going to go into a bar or restaurant, most of the patrons are those young adults, you're going to know that more than half of them aren't vaccinated and should be wearing masks, because that's the recommendation of the CDC now for indoor spaces. Again, that's uneven. Upstate in Newcastle County, 51% of young adults are vaccinated, to a low of 40% in Sussex County, a full 10% lower, and even lower, 15% lower in Kent County. As you get older, the vaccination rates improve, as you can see, 35 to 49-year-olds, almost 60% statewide, and then 50 to 64-year-olds, 72% statewide, and then the senior citizens, 93%, with strong vaccination rates in Kent and Sussex County. So as we look at our challenge, it really is to encourage and get the young adult population, which are increasingly more vulnerable to the Delta variant, spreading it among one another in an unvaccinated way. And of course, there are breakthrough cases and hospitalizations that result in the vaccinated groups as well. We're seeing that with the Delta variant. So as I said, here's a comparison with Sussex County. You've got 97% of Sussex Countyans who are 65 and older who have received at least one dose. By the way, those numbers are stronger in eastern Sussex than they are in western Sussex, but only 40% of those in Sussex County 18 to 34. So 60% there are not have not received one dose of the vaccine, which means they are going to be susceptible to transmission and getting the COVID-19, particularly the Delta variant, which is more virulent. It spreads faster, and it is providing or causing more serious illness among younger populations. So we're going to look at a lot of the different areas that CDC has recommended in the White House Task Force. We meet with Jeff Zients and his President Biden's team with the CDC with respect to universal masking in schools. That's something that we're looking at. As I mentioned earlier, the state of emergency declaration expired on July 13th, so we're looking at other emergency powers that the state has with respect to universal masking in schools. This being one of our top priorities, and we know that the young ones under age 12 are not eligible to be vaccinated. So important consideration there. We need to do that and do it quickly, and we will, because the school districts are deciding how to proceed in their individual areas. And looking at ways to increase vaccination at long-term care facilities, other healthcare facilities to protect the most vulnerable and make sure that we're getting everybody vaccinated, the workers there, and so that we're protecting those that are most vulnerable. Dr. Rattay has further detail on the spread of the disease, the seriousness among different demographic groups, and the context in which we are considering the decisions that we have to make over the next few days and into next week. Thank you again for joining us, Dr. Rattay.
Thank you, Governor. So as I often start in the past, I do want to provide an update on cases in our state. So first, let's talk about areas of concern. As I mentioned weeks back, we were lowering the threshold so we could keep a closer eye on the infectious activity in at a more granular level, a smaller level in our state. And what we're seeing now is that there are 12 zip codes with a case rate at or higher than 100 cases per 100,000 people, and a 10% or higher positivity rate with 5 or more cases. So that's the criteria that we're now using. And I will add that using the previous criteria that we used from the fall through this past spring, we do not have any zip codes right now that meet that criteria. However, as we know, we've seen significant increases in the state, and it's really helpful to see where we are seeing the highest case rates in the state, which clearly Western Sussex is a hot spot for us right now in our state. And it is also the area of our state where we have the lowest vaccination rates. So we are keeping a very close eye on this, but certainly this is of concern. Additionally, our case rate has increased about 80% since last week alone. Our 7-day average of percent of positive tests went from 1.1 on July 1 to 4.3% today. And hospitalization rates have increased in all locations. Over the past week, it went from 22 on July 3rd to 53 yesterday, and you'll see our numbers later today go even higher. One bit of good news is that our death rates have decreased in all locations over the past week. Additionally, our testing rates have increased 47% since last week. And with our announcement this week about testing, which I'll talk about in a few minutes, we do anticipate that our testing numbers will increase even more. And the 18 to 34 age range continues to have the highest case rates across the state, which again is consistent with what the governor just showed you, that this is the age range, an age range that has the lowest vaccination rates in our state, in addition to our children, 12 to 17. So let's talk a little bit about variants, which is a topic that's dominated the news and our messaging in the last few weeks, and it's extremely important. The Delta variant is the predominant strain in Delaware now, this past week accounting for 51% of the variant positive test sample sequence. So we had a total of 47 positive variants identified among our samples, and 24 of those were positive for the Delta strain. So we've had several weeks in a row now where Delta has been the predominant strain for us in Delaware. So let's talk a little bit more about Delaware, let's talk a little bit more about Delta and the spread of Delta in the US. This graph from CDC shows how the Delta variant has grown in the US from a small percentage in May. So we're looking really at the kind of a medium orange color here. It's a very small slice in May, but as you move forward to July, you can see that this color of orange has pretty much taken over the strains that are being seen. And this is true across our country, in our region and our state. And our concerns are numerous in regards to Delta, but especially because it spreads so much more easily from person to person than the wild type or the other variants. And of course, the majority of the spread is among the unvaccinated. However, our data are showing that a small amount of transmission can occur among fully vaccinated people. And this really is a pure numbers scenario. When you have a lot of an extremely contagious infection circulating in the community, even vaccines that are 95% effective won't prevent everyone who's vaccinated from getting infected. And that's what we're seeing now. More points on Delta. Things that we really want to make sure that you take away from this discussion is that vaccination is the best way to end this pandemic. It is the most important public health tool that we have. Vaccines are effective against death, hospitalization, and serious illness from COVID and its variant strains, including Delta. And the majority of infections are happening in the unvaccinated. Of the small number of infections that happen among fully vaccinated people, the illness tends to be milder. But certainly when we compare unvaccinated to vaccinated people, unvaccinated people are at much greater risk for serious consequences from COVID. So this week, we announced some new recommendations around testing, as well as new avenues or options for testing. First of all, I just want to say for unvaccinated individuals, individuals who have chosen to not be vaccinated, there is a responsibility that you have, which includes wearing a mask in all public places when you're around other individuals. But the new clear recommendations are, if you are unvaccinated, you should get tested at least once a week. Now, if you have been exposed to COVID, first of all, you will need to quarantine if you are unvaccinated, and you also should get tested 5 to 7 days after exposure. Now, for fully vaccinated people, this was a little bit of a change for CDC too, based on the Delta variant. If you have been exposed, you do not need, let me be clear about that. If you are vaccinated, you do not need to quarantine if you've been exposed, but the recommendation now is to wear a mask for 14 days, especially in public places, and to test 3 to 5 days after you have been exposed. So testing locations have expanded. So we want to make sure that folks know, what the options are. Testing is available at a number of static locations, including many pharmacies. There is a new federal program supporting some additional Walgreens locations, as well as some other pharmacies like some of our Rite Aid pharmacies. Additionally, in the 4 static vaccine locations that public health runs, we've got one in Georgetown and Dover. We've got one in Newark at Oxford or University Plaza, as well as the Canby Park in Wilmington. Those sites all now, as of yesterday, are also offering testing in addition to vaccination. But we also have community testing sites that are run by Curative that are still in operation. Important to know that testing at the state-run sites are free of charge, but you may see a charge at other pharmacies and medical providers that offer testing. You can look at our website to get more information about which sites are free, or you can contact the specific site that you want to go to get tested for more details. Let's talk about some new at-home and school location testing. So we have some different at-home testing options. Vault has been available for a while. It's a PCR test. It's free. Of course, you can get the Vault test when you go to our website, and you'll have a video connection, a Zoom call with a health provider who will supervise the specimen collection. LabCorp is a new at-home option, which is also available on our website. And this testing especially is to support those who are with symptoms or high-risk individuals. We're really, really excited about a new partnership with the Delaware libraries that we announced earlier this week. Our libraries have been amazing partners, amazing health partners for years, but this is a real exciting new opportunity that they're engaging in with us, where anybody can pick up a home rapid antigen test kit. You don't need a library card. You can stop by one of the libraries at open hours and get a test kit that you can do at home. We do want to make sure you know that if you have any COVID symptoms, please don't go to a library for a test kit. But it is a good option if you need to get tested on a weekly basis, or if you just want to pick one up in case you get exposed or have symptoms in the future. We're also really excited about an announcement we made a couple of weeks ago around school-based testing, where we're offering free rapid antigen testing for students and staff of K through 12 schools and child care facilities through a partnership with Quidel Corporation. Quidel provides the staffing, the testing, the analysis, the reporting, everything, relieving the schools of the burden to do the testing. And there's a link on our slide for more information, but we are certainly hoping that all of our schools in Delaware participate in this program. And finally, just a couple other things I want to wrap up with. A big shout out to our colleagues at Department of Education, especially Christina Loyce and Ann Covey, who have worked closely with us on promoting vaccination, back to school vaccination. There's back to school vaccination clinics running on August 19th for the first dose, and the second dose being September 9th in sites across the state: Howard High, William Penn, Lake Forest Central Elementary, and Seaford Middle School. So we encourage families to bring their kids, individuals 12 and up, staff, anyone in the community can come to these sites, but there's also other special activities, back to school activities going on at these events as well. So if you haven't had your children who are 12 or up, your adolescents vaccinated yet, you can do it at any time, but this is certainly a good option for folks to take advantage of. And then finally, again, with our partners at Department of Education, in addition to, I want to give a shout out to Dr. Rebecca Walker on our team and Dana Carr as well on our team, who've been organizing an Ask a Nurse Q&A session on August 16th. So for parents, members of the school communities, even students who want more information about vaccination, and even from a health perspective, what the year is going to look like for students, please check into this Ask a School Nurse session on August 16th at 7 p.m. Sorry. And with that, I will hand it back to you, Governor.
Thank you very much, Dr. Rattay. Some great information about where to get tested, how to get tested, when to get tested. You should pay attention to symptoms, cold-like symptoms, flu-like symptoms that you might have. Make sure that you get tested to make sure it's not COVID-19, to protect, others in your household and people you come in contact with. If you have been exposed and you know that, you should wear a mask. If you're vaccinated, you should get tested, obviously quarantine. If you're not vaccinated, we've seen across the country, we've seen this Delta variant sweep across the country, and some states like Missouri, like Florida, have really been negatively impacted. Louisiana, even places in California. Most of the states, most of the areas with low vaccination rates are the ones that have experienced this, the worst conditions. Our vaccination rates in Delaware are not where we need them to be, but they're higher than many of those states, which are significantly under 50%. We still have a lot of work to do. We need to encourage all of you who aren't vaccinated to take the step, get vaccinated, get answers to the questions that you have. The answer to all of these challenges is for more people to get vaccinated. And in the meantime, for each of us to protect one another, to follow the CDC guidance, particularly in indoor public locations where you might shop. If you notice, I go into Wawa for coffee every morning, and the staff there are now wearing masks. And I think it's important that we wear masks in respect to those employees and others who are unvaccinated, and that's the recommendation of the CDC. We are focused on guidance around schools and bringing students back into classrooms fully with in-person instruction, which is really important. We've seen these, if any Philly fans out there, you probably saw earlier in the year where Aaron Nola missed an outing in the rotation because he was not vaccinated. He had come in contact with one of the players who did test positive and missed a start as a result of that. You all know I like to brag about my nephew, who's a right tackle for the Minnesota Vikings. 3 of their 4 quarterbacks now are test positive, and they're not able to be in practice, and so they've got a guy who's new and inexperienced there. They could have avoided all of that disruption just by getting vaccinated. And so that's our major objective there. We got to keep folks that are being exposed tested so we know where the spread is. And we need to get folks to wear masks indoors and follow the CDC guidelines there so we can get back to where we were just a few weeks back on June the 20th, where we hit a low of new positive cases around 20% positive on our testing was 1% or less. Hospitalizations were below 20, and now they've gone up significantly, and we need to protect all of our citizens of our state. So with that, let's open it up to questions. We appreciate those who've joined us for this press conference.
All right, well, our first question will be from Jeff Newberg from the News Journal.
Hey, Governor, you sort of alluded to it earlier that you are considering whether or not you will use an emergency power to sort of issue a statewide mask mandate for schools. Do you anticipate doing that, and what is the timeline on you making that decision?
Yeah, it's something that we're definitely looking at. We need to make the decision pretty quickly because the schools and the superintendents are making those decisions. We're looking at the authorities that the state has. We do not have a state of emergency authority as we did previously. We know that particularly the little ones under age 12 won't be vaccinated. We have teachers and educators that aren't vaccinated that we need to protect everybody, and we know we can do it. We did it the last year before we had lots of people vaccinated, but we're also, we're not going to be remote there, and so we need to do it safely. So the question is what kind of authority we have to make those requirements.
And one more, if I may. Throughout a lot of the pandemic, Delaware was in lockstep with some nearby states when it came to restrictions. Some of those jurisdictions nearby have announced statewide mandates when it comes to state workers, healthcare employees being mandated to be vaccinated and or undergo some rigorous testing. Do you anticipate following suit? What is the timeline on that? And if you don't, why not?
Yeah, we tried to be clear in this press conference, the things that we're looking at. I haven't seen the data, the conditions in the states around us. It is true throughout. We've tried to be somewhat consistent with states around us that mostly involve, opening and closing business establishments. None of us kind of want to go back to that. Individual businesses are making decisions. You heard of some of those employers, Christiana Care, requiring that their employees be vaccinated. We will be looking at that as an employer as well. Various at-risk locations where there's a lot of traffic and the potential indoor locations, the potential for interaction among unvaccinated folks. So yeah, we're looking at all of those things specific to our own state, but obviously with some eye towards what's happening around us. One of the things that was an issue back last year at the end of the summer, if you remember, just to put it in the context in terms of the number of positive cases on a day-to-day basis, that New Jersey was requiring quarantining people from other states who were coming, other states who had case levels above 100 per day, and we're at 135 today. Just to give, and you remember, I was complaining about that because we thought we were in a better place. We've upticked from around 20 to 135, and so that increase has caused some concern there. The point really is to just establish some relativity with respect to where we were in the summer at a place which was a pretty good place. So essentially what we're talking about is protective measures so that we can go back to school fully, with children wearing masks, so that we don't have to shut down or restrict various business operations. And so there are measures that we can take focusing on mitigation, mask wearing, focusing on really getting everybody vaccinated that we can.
Our next question will come from Roman Battaglia from Delaware Public Media.
Hi there, Governor. I just have a follow-up question about the vaccine mandates. I've talked to you before a little bit about these mandates and about how California and New York are requiring them. And you mentioned part of the reason it's it's not going as quickly in Delaware is because there isn't the infrastructure to track vaccinated versus unvaccinated individuals. And I know that New York has an app that people can use to prove their vaccination status. Is building out that infrastructure something you guys are working on or are thinking about working on? And how long would that take to get that built in to, be able to consider more of the vaccine mandates?
Yeah, it is certainly, I'll turn it over to Dr. Rattay in a minute, it is certainly something that could help us know whether folks are vaccinated or not. You mentioned New York. That's a great tool that they have. One of the challenges for us is it gets extremely difficult for folks to know who's vaccinated and who's not. And that app that they have enables them to do that. And then there are issues around relationships that employers have with their employees. We have public health powers that apply in some circumstances, but not others. And we have employee relationships that are subject to collective bargaining and contractual obligations. So it's a little bit more complicated depending on which employee group you're talking about. Our focus will be on those groups where there's the greatest amount of risk. Correctional facilities, juvenile detention centers, healthcare facilities, places where state employees come in contact with the public where you don't know whether folks are vaccinated or not. It would be more helpful if we had much more helpful if we had a way of determining who was vaccinated and who wasn't. Dr. Rattay, any thoughts about that? We know that New York has that capability, and currently we do not.
Yeah, so we'd love to see a federal or a national approach, a standard approach to this problem. Because we know people cross lines all of the time. In fact, the New York app has some assets to it, but Delawareans going to New York may not all be in their system, and vice versa. So we're really looking at what's available right now. We, as we have all along, we've encouraged individuals to keep their vaccine card. Is that so important? Last week, we made available a public portal for people to be able to access their vaccine information through our Delvac system. But we are looking at other approaches, either apps or just an approach where you can keep an electronic version of your card on your phone. I think what would be ideal for all of us in Delaware and across states would be to have a consistent approach, but that doesn't look like that's shaping up to be right yet.
Yeah, and I have one more follow-up question just for you, Dr. Rattay, not about the vaccines, but as we know, COVID has shortened life expectancies, nationwide, and that has disproportionately affected minority populations. We often see that those populations, the reason the life expectancies are shorter is because there's been a lack of access to medical screenings and treatments for various things. And because of COVID, people just haven't gone and seen their doctors. What can or will the state do to encourage people to re-engage with their healthcare providers to get those screenings and treatments for important health conditions?
Yeah, so I think there's two aspects of this, and one, I will tell you, I was looking at our breast cancer screening data yesterday. All across the board, a lot of our preventive screenings have decreased significantly, but we certainly have a concern about an equity concern where certain populations may even be impacted more. So as it relates to testing and vaccination, we've been working very closely with community partners on the ground, and we're going to continue to do that to ensure that the testing access is there, the vaccine access is there, but also, as you mentioned, we got to get back to some of our normal routine health screenings and chronic care management approaches that are impacting people quite likely our minority populations more so. So that outreach isn't just limited to COVID testing and vaccine, but it's really, but it also includes making sure people are taking care of themselves.
Yeah, and I'd like to make a comment about that because we have really leaned into the outreach effort, both in terms of testing, months ago and vaccination. If you look at those rates, and they're on our website, so I would encourage you to do it. My Healthy Community under de.gov/coronavirus. That just recently the vaccination rates for Hispanics has increased over the vaccination for the white population, and among African Americans, the vaccination rates for older African Americans is just slightly below the population and the white population. Where they lag is in the young adult demographic, so 18 to 34. So the total numbers is about in the mid, what did I say, 45, 46%, I think, in the data. But if you look at the subgroup of African American young adults, it's in the 30%. And the same is true around geographic areas. And so you really have to get down into the specifics of that data to understand where the higher percentage of people unvaccinated, therefore more vulnerable to the Delta variant, where we need to really roll up our sleeves and make sure people are getting vaccinated. But I think it's important to point that out because if you remember back in the spring, we had outbreaks in the Hispanic population across our state, particularly associated with the poultry industry. And we were worried, and rightly so, about getting vaccines into that community. And, over the last couple months, they've accelerated over the norm. So it's interesting that some of the assumptions that we make, the data show something different.
Our next question comes from Katie Tapling from the Delaware Business Times.
Good afternoon. Governor, I wanted to ask, as a member of the National Governors Association, I'm just curious what you're hearing from others about the so-called vaccine passport. Obviously, New York City is the closest to establishing sort of a requirement where you have to show your vaccine card to get into a business. What are you hearing from fellow states? What are your thoughts about that for Delaware?
Yeah, so first of all, what I'm hearing from other states is considerable anxiety and fear around the Delta spread in their states. Governor John Bel Edwards in Louisiana, in Missouri, in Florida, and some of these other states where the vaccination rates are quite low, and they're seeing their hospital emergency rooms being overrun. Even at 53, which is where we are in our hospitalizations, that's considerably less than the 475-ish peak that we hit in the last peak. So these other states are seeing hospitalizations that are overwhelming them. And so we hear a lot about that. There's less talk, there's more talk about that immediacy and the challenges that presents than the passport idea, which not many states really have that technology to implement. We talked about, you heard us talking a minute ago about New York. They do have a mechanism that makes it easier to do. And so we don't have that luxury at the moment. And so our focus has really been on getting people vaccinated, trying to think about the incentive. What is it that's preventing people from taking that step, and trying to meet them where they are, and to move them to get vaccinated. We continue to chug along. 70 or almost 80% of vaccinations now are done at the local pharmacies. Anybody can walk into their local pharmacies today and get a free vaccine. We're not, we don't have the big clinics. We don't need to have the big clinics to move the vaccines in arms, because the demand, like we did last spring, because the demand is not there. And so, yeah, it would be really good to have, but it's not something that's at the top of the list that we're looking at.
And I'm glad you mentioned that, because my second question kind of ties into that and other thoughts. There have been concerns from health experts across the world at this point about this virus, the COVID-19 mutating so much that we can't get it under control. Christianity obviously has mandated that all of its employees have to get at least one vaccine dose by the end of September. They have 12,000 employees. The state of Delaware has 32,000 employees. As you mentioned, much of that is controlled by collective bargaining, and the state wants to focus at risk, people who work in at-risk areas. So we've tried encouraging people with rewards, a lottery system, and businesses donating, free orange crushes, things like that. What are your thoughts about how do we get people in the state of Delaware to get the vaccine so we don't lose control of this situation?
Yeah, so number one, we congratulate and thank Christiana Care. They're a healthcare organization for taking that step. It's a leadership step. They've been very supportive of our efforts, particularly last spring in terms of doing testing initially when we didn't have the infrastructure to do that. It is a challenge. One of the things that we'll hear as we look at this issue with respect to those who work in congregate settings, which, as I said, something that we're going to look at, is the reality of driving needed staff. Most of the employers, as I'm sure you know at the Times, are the biggest complaint I hear is they can't find employees for the jobs that they have. One of the areas where that's really relevant for the state as an employer is in our correctional facilities. I mean, how many we lose, unfortunately, correctional officers at a regular pace just based on normal retirement after the incident of February 2017. We had a significant outflow of correctional officers, and the problems that we've encountered in those prison facilities are in part due to understaffing. And so we don't want to make things worse at one level by doing something at another level that may be necessary, but something that we might be able to do it a different way. And so we are looking at all what is the best way. And we had this question came up on our White House call just the other day with respect to vaccination mandates and mask wearing mandates. How do we get people that aren't vaccinated to get vaccinated? What's the best incentive way to do that? If you look again, I talked about the Minnesota Vikings and my nephew earlier, but the NFL has basically said if it's your team that's caused the cancellation of a game, you take the loss, and something like your team has to pay the other players some significant financial penalty. All of those things, I think, are things that need to be considered to get more and more people vaccinated. Your point, Dr. Rattay, is better equipped to answer the question about getting the various variants of this vaccine from overwhelming us.
So I can add, I think this is a really real fear. The fact that we have a lot of this virus circulating now means there are a lot more opportunities for mutation. That is one of the reasons why it is so critical to increase our vaccination rates. It's great that we're at 73% adults with one dose, but it is not enough. We have got to do all we can to drive up our vaccine numbers even more. And so we will all continue to look at what options are available and I think put just about anything on the table.
Our next question is coming from Tim Mastro of the Delaware State News.
Hi, everyone. This was brought up during the presentation how Western Sussex is kind of lagging behind in terms of vaccinations. Is there a reason for this? What kind of community outreach have you done there? Some of those rates are below 35% in terms of fully vaccinated. I think one zip code is even below 30% based on the recent numbers.
Yeah, and if you overlay race as a factor there too, it's lower still. And yes, is that an area of concern? It absolutely is. And we've tried to work, and we do work and have been for months now with community groups. Our schools have been good partners down there. I hate to say that there are potentially political reasons for that, unfortunately. We continue to try to meet people where they are, use trusted sources in the community. You don't see that in other places. And try to find. I was at Delaware State University for a vaccination. They had a vaccination clinic that particular day, and I was talking to their new football coach in a couple years, and he brought 10 or so players out from all over, from the DC area. One guy was from Florida, from Delaware, and they were all vaccinated. And the coach said, that he had about 80% of his student vaccinated. Both UD and Del State are thinking about making it mandatory as their students come back on campus. And so those are folks that we can, employ to try to get the message out, but we need to, and we will continue to do that. Unfortunately, there was a big article over the weekend, I think in the New York Times, trying to characterize Americans that were unvaccinated and to try to figure out how to get through. I think the most important message for us today certainly is we want to get all our children back in school. They've lost a lot in the last year and a half, and we can't afford that another year. We don't want to restrict our businesses in a way that's going to hurt them financially again. But we got to do both of those things while keeping people safe, not putting vulnerable populations at risks to hospitalization and death. Those risks are better than where they were before. Let's just be clear about that. We've got 70%, 73% of adult population over age 18 vaccinated. No children under 12 are vaccinated because they're not eligible yet. We're doing pretty well in that 12 to 17 age group, particularly compared to the young adults 18 to 35. We just really need to think about and meet people where they are, whether it's in a small minority community in Seaford or Laurel or Del Mar, or whether it's in a beach community in Eastern Sussex. The difference between Eastern Sussex and Western Sussex is dramatic in terms of those vaccination rates.
Then I was wondering how much information you have on the recent hospitalizations and just the Delta variant looks like it is affecting younger people more than the original COVID. Has Delaware's hospitalizations become younger? And also you would assume the older generation is probably more vaccinated than the younger generation. What effect has this had on hospitalizations as well?
Hugely positive effect for the senior citizens. They're 90+% vaccinated, to almost 90% fully vaccinated. Dr. Rattay can respond on the younger profile of folks hospitalized. Remembering that today our hospitalization number was 53, and our low number was, I think, 15. Last year, the high number was 475-ish.
Yeah, so I think a success story certainly of the vaccination work so far is if you look at our My Healthy Community and you look at the flat line around deaths. So certainly the fact that a lot of people right now we're seeing increases in cases, but we know that a lot of people are protected from the most serious consequences, including hospitalizations and deaths. We haven't been collecting age on hospitalization, but we are looking into getting as much information as we can about those who are hospitalized going forward. And we do agree it's important to have as much information as possible about vaccination status for those who are hospitalized as well as for those who die.
Next up, we have Amy Cherry from WDEL.
Hi, everyone. Dr. Rattay, I'm wondering if you could give us an update on how far away we may be from having a vaccine for younger children that could possibly ease some of these concerns around sending kids back into the classroom.
Yeah, Amy, it's a great question, and we all would love to have the answer. And we've heard a little bit of mixed messaging on this, that it could be as early as September, but it may not be until December that there's an EUA approval for ages 5 to 11. We're ready. We're eager to move forward with vaccination among this age group. We know that it will give certainly a lot of peace of mind to parents, children themselves, teachers, families, all of us. So we're really eager for that time. In the meantime, these layered mitigation strategies that we've had in place for schools all along are critical. They worked last year. We saw very little spread in our schools last year. Masks work. We know that they do. And so while so much of the school population is unvaccinated, wearing masks in school is extremely important, as is regular testing, weekly testing for those who are unvaccinated, in addition to some of the other mitigation strategies that we've had in place, like isolation, quarantine, contact tracing. So we're looking forward to having the entire school population vaccinated. In the meantime, these layered mitigation strategies are critical.
Amy, if I may just chime in, with our White House task force call earlier this week, that was the number one question among governors to the White House and the CDC, a real sense of urgency around the approval of that vaccine for the younger children. That was the first question that Governor Asa Hutchinson, who is our chair now, asked to start the meeting, and other governors share that sense of urgency.
Thank you so much.
Our last question will come from Sarah Broomfield from the Associated Press.
Good afternoon. I know you guys spoke already about hospitalizations, but I'm wondering if you could talk a little bit about hospital capacity, where the state is now, and at what point do you get worried?
Yeah, so that's a great question, and fortunately, we're in really good position there. You know, from the beginning. That was one of my biggest concerns the last spring, as we saw our cases climbing, and I saw what was happening in northern New Jersey and New York City and California, in Illinois, where they were kind of running out of hospital rooms, critical care hospital rooms, and running out of ventilators. And so we kept a regular list of those that were being utilized, and we never, even in the winter surge that we saw, where hospitalization number hit 475, that's compared to where we are today, which is 53. So we're at 53 today. We're at 475, and we weren't bumping up against that limitation. What happens is in the hospitals, we're very good at doing. They manage their in-hospital populations, right? They cancel and defer elected surgeries, and some of the issues, frankly, you heard Dr. Rattay talk about testing that wasn't being done, are affected by that. But it does enable us to meet a surge, and so you can just tell by that number, even at 475, we still felt like we had a lot of headroom, and at 53, of course, it's nowhere near that.
And also, Governor Carney, I'm wondering if you have any stance on booster shots at this point.
Yeah, I'm not the right person to talk about boosters, but Dr. Rattay, I'm sure, is able to address that.
Yeah, so this is another topic where there's some uncertainty. I was just on a call a couple nights ago with the CDC director, Walensky, who says, there's not an immediate plan for booster shots for the broader population. That is different than what we are expecting, which is a third shot for those who are immunocompromised and likely for older individuals. That being said, I don't think any of us will be surprised if and when booster shots come back around or come around, especially given the mutating strains in the community. It is likely that we will see a booster in the not too distant future. And so while we don't know when that will happen, we are planning for it to ensure that as soon as it does happen, that Delawareans have access to a booster shot.
And that was our last question.
So again, thank you to the media for joining us today. Thank you to the audience online for joining us as well for this update. We're just a couple weeks beyond meeting the President Biden's objective of 70% of adult Delawareans having at least one vaccine by July the 4th, just a couple weeks down from the end of the state of emergency. And yet we see our positive cases, our hospitalizations rising at a rate that causes us to concern, that causes us to have the press conference today. We recommend that folks follow the CDC guidelines when you're indoors and wear a mask to protect others and to protect yourself, but mostly others. If you're asymptomatic, you have the virus, but you're not experiencing symptoms and you don't know that you're carrying the virus. We're seeing some of that. We have two really important objectives. One is to get all of our children in school, even the little ones who are not eligible to be vaccinated, right in a couple of weeks in early September. Each district's a little bit different there, and we want to continue. We don't want to close down sectors of the economy like we did months ago. And so the way to do that is just to be careful, wear a mask indoors as CDC has recommended, but most importantly, get vaccinated if you're not. Encourage, I know like me, everybody has friends and family that aren't vaccinated. Don't make them feel guilty about it, but maybe if that works, I guess, but try to meet them where they are, get their questions answered and help them get to a place where all of us can be safer. So thank you for joining us. We look forward to seeing you next time.